I want you to do what the right thing is to do is what I want to do. All right, are we ready? All right, so we are in session for a workshop scheduled at 2 p.m. We're 18 minutes late on the March 13th. Call to order. Can I get approval or are there any amendments to the agenda?
Oh, excuse me.
Pledge with me, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
There's no pledge on there, JJ, so
You got the great pace there.
All righty. So, any amendments to the agenda? Hearing none, can I get a motion, please?
I move we approve the agenda as written.
Second, Mr. Chair.
Further comments? Roll, please.
Mr. Gold.
Aye.
Vice Chair Boyce.
Aye.
Chairman Pash.
Aye.
Motion carried.
Department reports. I don't think we have any departments here.
We have none today.
Okay, presentations number 4A, 2020 Census. Mr. Cummings.
Okay, thank you very much for having me here today. The reason for my visit is we are on the road to 2020. The census is going to happen whether we like it or not. April 1st, less than 400 days to go. When I put together this presentation, it was exactly 400, but time is clicking on. Why do we do a census? It's in the Constitution right from the start, and it was declared that we'd have a census within 3 years of convening the Congress. And so the first one was made in 1790, and it's happened every 10 years since then. One of the main reasons to do the census is to figure out how many seats each state gets in the U.S. House of Representatives. This is the results from 2010 census. You can see a couple of states lost seats, a couple of states gained seats. Probably no big surprises there. You know, Texas has been growing like crazy, but New York to lose a seat, that's kind of surprising. Or actually, yeah, lost 2 seats. This coming census will be again used to determine how we're going to divide up the 435 seats. There's speculation that Oregon might gain a seat. I don't know. We'll have to see how the numbers come out. But even if the number of seats stays the same, the district lines will change, and they'll change based on the information that we get from the census. Funding, I know this is too small to read, but the punchline is in 2015, Oregon received $10 billion of federal money out of a total of $675 billion that it was redistributed to states, counties, cities, and other municipalities. A lot of this is based on census. So if you undercount here in Oregon, you can figure that's $2,500 of federal money that you don't get for every person that you miss. Other uses, state legislative districts are drawn, school districts, voting precincts, state and local and tribal governments make planning decisions. Businesses use this data to make planning decisions. I remember I lived in a rural area of northern Arizona going to college, and one day my brother-in-law, who's a professor there, said, well, it looks like we're going to get a McDonald's. Why? And the census had been released, and Flagstaff moved over 100,000 people, and I guess that was one of the criteria that McDonald's used. And sure enough, he was right. So there are a lot of uses of this data. What's new for 2020? We're optimizing the self-response. Some of that is what you saw back in DC. We're hoping that 45% of people will respond via the internet. It's more efficient for us. It costs money to mail back and forth. It costs money to have somebody take a paper form and tabulate it and put it into our database. So if we can get people to use the internet, that's a big win for us. We're also going to have a toll-free number. If you don't want to fill out the form, you can call in. and then finally paper, the traditional method. We're also re-engineering our address canvassing operation. We're only going to do about 30% of it in the field this time. There's so many new tools have come available that help us verify addresses without actually going out there and driving by. We're using high quality data from trusted sources to reduce the in-person follow-up, and more automation when people are actually in the field. As you pointed out, they're going to have GPS-enabled devices, so they don't have to enter in where they are. The device knows where they are. So,
Sir,
Why don't we let him finish his presentation?
Okay, that's fine.
go ahead.
okay. So we've been working for the last year or so where to establish the count, and that's going on through this year. 2020, we have to begin motivating people to respond, and then March through June, we actually do the count. And December 31st of 2020, we present it to the president, and then it'll be available to all the public at that point. What do we ask? We've got 10 questions that we know are going to be on the census. There is an 11th question that's been proposed, and it's actually going to be decided in the Supreme Court, I think next month. It's on the docket for next month. So that question number 11 about citizenship may or may not be there. At this point, I'm kind of planning for it's going to be there, and we need to deal with it. And obviously, it's a hot button issue in today's political climate, and so we need to get out in front of it and address the question, and hopefully calm people down, motivate them to respond anyway. And I guess the only thing I'll say about the citizenship question, it's mandated by law that everybody participates in the census. It doesn't say anything about answering all the questions. So, languages, we've got a lot of language support. The internet and self-response will be in 13 languages. The paper form is only in 2 languages. We'll have questionnaire help in 13 languages, and then we'll have language cards and guides printed in 59 languages that can be distributed. That's not enough languages to cover everybody. I know that there can be challenges. Not everybody speaks one of those languages. So again, it's another reason to reach out. Hopefully if you speak only a language that's not on this list, hopefully you know somebody that can help you translate, understand, and ultimately participate in the census. So how will it work? Almost everybody's going to receive the census either in the mail or from a knock on the door from a census worker. We do not mail to P.O. boxes, and I know that's an issue in rural communities. The logic goes something like this: nobody lives in a P.O. box, and we're counting by dwelling unit. Also, you could decide to sell your house and move to another one, keep the same P.O. box. So if we were counting you in the P.O. box, we might have missed this critical thing that you moved from one census tract to another, perhaps. So we're not going to mail to P.O. boxes. For folks that don't receive mail at their home, they can go online next March and fill out the census online. Put in their name, put in their address. We'll find the right spot for them, and they'll be crossed off the list. We don't need to count that address anymore. If people don't respond that way, then that's when the door knocking begins. And our practice is to knock on the door once. If we can talk to somebody and take the census at that right then and there, great. If not, we'll leave a note, basically the paper version of the census, to say, here, please fill this out, go online, phone in, or mail it. And if we don't hear back, we'll come back again, and we'll come back a third time. If we can't get anywhere by the third time, we'll take a guess. We'll maybe talk to the neighbors, say, does anybody live there? How many people? What can you tell us? And that's not the way we want to do the census. We'd much rather have every household respond. So, yeah, then less than 1% are going to be counted. We're actually counting early in northern Maine and remote Alaska, sending out sled dog teams or something, and they have to do it before the snow melts. So they're going to actually be doing it January of next year in some of these really remote areas. It's a very important point. The data that we collect is private and confidential, and we hold this in the absolute highest degree possible. Title 13 and Title 26 are both laws that say basically census data has to be kept confidential and can only be shared in the aggregate. So we'll aggregate the data up so that we know something about the population within a census tract or a census block, but we will not disclose an individual respondent's response, at least not for 72 years. There is something that's not on the slide. It's kind of cool. After 72 years, we will release detailed information. So I'm kind of looking forward to this. After this job's over, I'm going to take some time. I know about where my grandfather lived, but I'd like to see the census data. Find out what house he lived in, that sort of thing. But yeah, the penalties are severe. If I or any other census employee wrongfully disclose, it's 5 years in prison and $250,000 fine. And none of us want to see that happen. Somebody asked a question, I thought it was a good question. What if after the census is done, the administration reaches out to us and says, I need a list of whatever they might want to ask for? And the answer would be no, because this applies to, we can't release it to the public, we can't release it to another agency. It has to be held in confidence. So if the White House were to make that request, we would say no, and it might end up in court, but my guess is this will stand. There actually have been 2 other instances where other governmental agencies tried to get a hold of detailed census data. They both went up to higher courts, and both were just slammed down. No, Title 13 and Title 26 prevail. The other question that comes up is the Japanese internment camps that we had back in World War II. Sadly, that was census data that led the government to those individuals that were put into the internment. And I thought, well, there goes the whole argument about privacy and confidentiality. Doing a little more research and learning more about it, Title 13 and Title 26 actually went into effect in 1953, and they were largely a reaction to that exact instance, that there was this data out there and somebody thought of something to do with it that wasn't the original intention of that data. And so Title 13 and 26 put a stop to that. Partnership. So how do we get out and reach the communities? That's why I'm here today. I'd like to talk to you about partnership. We'd like to work together with the county to educate people about the census and encourage their cooperation, and engage organizations to reach out to the hard-to-count groups and folks that might not be motivated to respond to our national campaign. Hard-to-count populations. Foreign-born immigrants, there's a natural tendency to either not understand why we're asking, or maybe a hesitancy to even want to participate. And again, with the confidentiality assurances, we're hoping that we can get a complete count of foreign-born and immigrants. Children younger than 5 tend to be miscounted, and I'm not sure exactly all the reasons for that. Possibly in divorce situations where the kid lives with mom sometimes and dad sometimes. Maybe doesn't get counted in either place, maybe gets counted in both places. Seniors tend to be difficult. homeless, the homeless population, that's one that needs a lot of work to try to figure out where they are and coordinate the count. Migrant workers, renters, and we're thinking people with low internet access. If you did live in a rural area, maybe you don't have good internet at home and you have a P.O. box, so you're not going to get it in the mail. I don't want to miss those people. So again, through our efforts, hopefully we can reach them. And I know I've been talking to the Oregon State libraries, and they want to make sure that there are good internet connections available in all the public libraries. So if we can somehow reach that person that lives in a rural area, make them aware, motivate them to take part in the census, they can maybe one day just go to the library and use the computer there. So multiple strategies could potentially work. We do have some tools. One tool that we have is Roam. It's a response outreach area mapper. And forgive me, I've been with the census for 2 months. I'm drowning in acronyms, but I'm sure I'll get them sooner or later. What this does, you can see that it starts out at the giant map of the U.S. and the dark blue areas are areas that we feel are going to be hard to count. And you can pull this up and zoom in. I have an example of Polk County, where you can see the dark blue, 30 to 49% non-respondent, and the darker green, 25 to 29%, and the light green, 20%. So it kind of can help you. We can do this for Curry County as well, and maybe try to figure out where is the potential undercount coming from, and focus efforts on those areas. When you go into Rome, there's a lot of additional information that you can pull up by census tract. For instance, down here towards the bottom, population 5 and over who speak English less than very well and speak Spanish. The next line, Russian, Chinese, Korean. So it can kind of help you figure out, where your hard to count population might be, and tell you a little something about what you're going to find there.
It's very sensitive.
So I'd like to talk about establishing a complete count committee. These are volunteer committees that are established at the state, local, or tribal government level. That can include community leaders and organizers, and ideally we're going to increase awareness and motivate respondents to respond to the census. State of Oregon is forming a complete count committee. The kickoff meeting is April 4th, so you may be hearing more about that. But there's no magic formula for what a complete count committee looks like. It really, we want to do whatever makes sense for your community. Not everybody has all the same aspects of hard to count populations as everybody else. Resources are going to be different places. I did meet with the city manager at Gold Beach this morning.
Jody Fritz.
Yes, and thank you. She was very supportive of the idea, and again, we're going to have a statewide complete count committee. We could have countywide. We could have one in each city. There's going to be kind of an overarching one with the libraries, it looks like. And I asked her, I said, what do you think? Gold Beach, do you want to do a complete count committee here? And how can we help? And she said, I think it makes more sense at the county level. See how your meeting goes this afternoon. But she thought, the cities are small enough, and there are a lot of unincorporated areas that wouldn't be covered by the cities. So she would like to participate in the countywide complete count committee if we should move forward that way. The final thing is recruiting, and we're staffing up. These are temporary jobs, part-time jobs. You can kind of choose your own hours, but we need to hire people in the local communities to do both the address canvassing operation that we're going to have going on this summer, as well as the actual enumerators that we're going to use next spring and into the summer. So decent jobs, and could fill somebody's need. I have a friend up in Portland that signed up. She's retired, and she said, "Oh, this would be a good reason to get out of the house and give me some extra spending money." So she's gonna do it. We also, we don't want to hire a bunch of people in one area and then ship them to another area to do this work. We'd rather hire locally, reduce the travel time and expense, and also it's just a better connection with the community. And that's where you apply for jobs. And I think that's kind of it. What are your thoughts on complete count committees? Would you support such an idea, or?
Well, I think it's imperative for rural Oregon right now to have a complete count. Given the federal dollars that we stand to lose, because or lose by not getting because we don't have a complete count.
Mm-hmm.
I can't imagine that. I think we'll be surprised how many people we add to our census here in this county if we have a group that goes out and tries to do a complete count.
Mm-hmm.
I would support it.
Okay, very good. So I guess next steps. Anybody else want to?
Should I be looking for work, maybe?
No, I would want to know what the scope of their work is and what you expect and all of that before I said, oh yeah, let's get one of those committees, so.
Yeah. Well, so this is where I'm kind of in a weird position. I mean, most of my adult life, I've come to a meeting like this, I want to sell you something. And I know exactly what it costs, and I know exactly what you're going to have to do, and I know exactly what it's going to do for you. This is this is more than squishy. There's no law that says you have to form a complete count committee. I really want you to, though. And there's no set way to go about it. I think the best thing to do is identify a couple of people that can start brainstorming on what are my issues. How big of a deal is it with the indigent population, or the homeless, or the whatever, and start working on strategies to address that.
Sorry.
Oh,
Thank you, Mr. Chair. No, I would. I just know that you have some thoughts on how we might proceed. The only comment I would have, just to get a good feel for what the homeless population is. That's a tough count.
It is.
Tough job. But for the reasons you have stated, we heard at AOC the other day, yeah. Do you have an idea how we might?
To be honest with you, the only population I'm really concerned about us not getting counted is the homeless. I think in Curry County, I think we have, most people have computer access, or, they're going to read a newspaper or social media or something. But I am worried about the homeless, because I am told that our homeless counts are grossly inaccurate. And that doesn't...
We just don't know.
We don't know.
Yeah.
So we hear that, they're missing all these people. They're not going up into the hills to count the homeless, etc. We're getting select numbers. So I think that's one area that I think we really need to focus on, is making sure we get an accurate count of the homeless and doing more than the standard homeless count that we have been doing.
Commissioner Gold?
I would, like I was just going to say previously, if we're going to set up a complete count committee, I think one or two of those members should be part of those homeless advocates that are here on a regular basis talking to us, because I think they would have more of an in as far as finding out what the exact counts are.
That's a great idea. And the way the homeless count will work is it happens one day, March 30th. And so basically, prior to that, you need to spread the word that there's going to be a count. It's going to be at this location or these 5 locations, whatever, the county chooses. And then we will send, but we need to know beforehand how many people that we need to send, How many enumerators do we need, and where do we need to send them? So it's sort of a coordinated effort. Couple of cities have talked about, putting on free soup and hot coffee night, and just promoting it at every homeless shelter and every encampment. Anytime you come in contact, do you know about the census? Where are you going to be March 30th? You have to keep repeating the message.
Also, if I may,
Hold on, she was next.
whoops, I'm sorry.
I was just going to say, letting these homeless advocates maybe talk to the homeless and say, why should you be doing this? I would
Exactly.
think it would be to their benefit so that we could get them more services, et cetera. So,
Exactly.
Commissioner
That's a
Bull.
great
No,
suggestion.
just potential put some people to work also.
Yes. Yeah.
So,
I think if you offer them a free meal, they're coming.
Yeah.
I want to say this, though, Julie. I respectfully disagree with you. I personally know of 8 or 10 people that have no internet service and don't have cell phones in this county.
that's rare though, isn't it?
I know, and I'm not out there all the time. I know of 8 or 10 people. So I think we're going to find that if we have a
I
total
know
count
a
committee,
number two.
I think you're going to find the numbers are going to be surprising at how many people don't have access and aren't even willing to come in and sit at a computer or,
Yeah.
and that's why if they have a cell phone, something like this tested program could be really helpful because it can get that information in. But I think for Curry County to get what it deserves from this, I think the more we can do for 100% census, that we should do.
Fantastic. Our goal.
I've got a couple of questions. One, what is the hourly wage for these part-time
It's
employees?
13 or 15. they
Is
said
it the
in Washington.
minimum wage? I
No,
have
it's
no idea.
13 or 15, I think they said in Washington. It was pretty good.
Okay, thanks. And then my other question was, I have concerns about internet security, whether
I was wrong.
people could fill out the forms twice, that type of thing, so they would have long-term effects on the election and number of congressmen, that sort of thing. What kind of security do you have in place for that?
So I can't really speak to the technical aspects of web security, but I will tell you that's hugely important. So I could find out more information about that if you like. When somebody logs into this website, it is secure, and they provide the answers to the 10 questions or 11 questions that are going to be on the census form. I think what the way we prevent somebody, say, inflating their numbers and answering twice is we're going around this summer to do this address confirmation process. So let's say I live at 123 Main Street, and I go in and I fill out the information. I think I want to do that again. I'll put in that I live at 124 Main Street, and
Or
do it a second
123A
time,
or
and
something like
it'll
that.
say doesn't exist. Sorry, so it won't accept any more than one response from each resident.
What if you said you had 2 apartments in the same residence?
That's
just
what
saying.
that's what we need to find out through this through our address canvassing.
I'm just worried about the integrity of the whole thing.
So our baseline is this list of addresses that will be ready to go before the end of this year. Any address that's not on that list is not an address. And if you decided to subdivide your house and call it apartment A and B,
Tough luck.
tough luck. We'll catch you next time. But we should have picked, if you did that legitimately, say last year, we'll figure that out when we do this address canvassing. Say, oh, this single family house, it's not a single family house anymore. It's a duplex, a triplex, whatever it might be. So that's one way that we're going to defend ourselves. The other thing, the data gets, I don't know what the right word is, it gets reviewed. So let's say somebody said, yeah, I've got 12 people living here, and it fills out the census form. That might raise a red flag, and somebody might go knock on the door just to verify.
So
it's
you
not like
spot
it's
check
not like
or-
we're going to discount that answer, but we might go back and try to verify, or give a phone call or something.
You've got enough money to do that?
Yeah, we have some money.
Okay. I mean,
All
that
right.
gets
Yeah.
intense.
Any other questions? Thank you, sir.
Thank you.
Well,
And I'd like to, I'll leave you with some more detailed information. There's more information here about the complete count. And,
And then will you be getting in touch with us about the complete count to help coordinate that? Are you going to be like the district manager of this, or?
Do you want JJ to have one?
There's only 4, so.
Is that enough?
You have a couple more?
That's
That's okay. This
We'll
will
be
fine.
okay.
We'll be fine. Here.
Can I ask,
Sure, go ahead.
where are you based? I missed that if
I'm
you
in
said.
Salem.
Okay, so you're going around to all the counties and cities. You were at Gold Beach this morning, Brookings?
I wanted to see Brookings, they didn't have time, so I'll catch them next time.
Okay.
John, can you go back to the podium so we can pick you up on the camera?
It's okay.
Sorry about that. Yeah. Yeah, so there are actually 3 partnership specialists in Oregon right now, one in Bend, one in Portland, and then me. We want to hire 3 more. So I'm not sure where number 4, 5, and 6 are going to be located. Maybe there'll be somebody that's closer. But whether it's somebody new that we hire or me, I'm happy to spend as much time down here as I need to.
Okay.
You know, that's our commitment to you. Is
Plus fishing is coming in pretty soon, too.
No, it's just data. That's all I'm interested in. But no, we'll definitely, you know, either myself or somebody else will be available to work with you.
Thanks, John. I
Okay,
appreciate it.
thank you
All
very
right,
much.
Mr. Cunningham.
All right, 4B, we have Curry Health Care Provider Recruitment and Retention from Ms. Summer Matheson.
Hey, Summer. The bottom left is that. I finally discovered it. It says Country Doctor, if you want that.
Yep.
It's the front page of the Ruralite.
Well, so my computer died. And I actually pulled what they could in my PowerPoint, so that was. I'll be brief. Summer Madison, Economic Development. I'm here to share with you some ongoing efforts to recruit and retain healthcare providers in the communities. As you know, this has been an issue that continues to challenge our economic vitality. On the 7th of September last year, Boyd Allen wrote about a nursing shortage that threatens rural healthcare locally. And it's a crisis level that has been brought on by increased access to healthcare, aging workforce, and a lack of educational capacity to train new nurses. Let me see if I can get this thing going. JJ, how would I access?
Do you want to, oh,
Here? Thank you. There we go.
and do you want to hit slideshow up at the top somewhere?
Go to slides, yeah.
Over to the right. Slide,
I don't see it.
yes.
Slideshow, yeah. And now from the beginning, all the way to the left. Right there. You got it.
There we go. Okay. And then arrow right. Perfect. Okay. So the most recent edition of Curry Electric's Ruralite sums up our challenge in the following statement. Across the nation, rural communities suffer from a shortage of medical providers. Clinics in isolated areas operate on thin margins, limiting their financial ability to recruit new medical personnel. Physicians are disappearing from the map of rural America. About 60 million people live in rural America, according to the U.S. Census Bureau. This means 1 in 5 Americans live in a uniquely challenging healthcare delivery environment. You have an elderly population, a sicker population, and a lower income population. Yet you have the fewest options available when it comes to seeking healthcare. On March 6th this year, Commissioner Boyce hosted a roundtable discussion in developing what is now referred to as the Curry Healthcare Provider Recruitment and Retention Project. So we're shortening that with CPR. Some great things came out of this meeting, like learning that there's a $10,000 tax credit available to nursing faculty locally. The Coos County Coalition has made similar efforts that will act as a model for Curry County, and that there is a great desire to collaborate and support a unified effort in recruitment and retention. Some of the challenges that were shared is housing, local resources, and adequate services. However, some of the assets that were identified were a willingness to work together to unify recruitment efforts, marketing quality of life, natural resources, and recreation, recognition of long-term succession ideals to support and empower opportunity for local youth. On March 19th, OHSU is going to share the results of their South Coast Research Coalition's healthcare recruitment study. And coincidentally, I just received a call before the workshop from the gal that did the study. She also advised that she did a similar study for education. She'll be proposing that the night before, and offered that information to us. Although she did say it didn't take Curry County into account, I think our demographics are similar enough that we can relate and pull some information from there. So I'll be in attendance on the 19th of March, along with some partners, Southwestern Oregon Workforce Investment Board, South Coast Development Council's been invited. SOEB has really recognized the need and has worked to create and sustain healthcare education programs locally. On the 26th of March, the Curry Healthcare Provider Recruitment and Retention Project, CPR, will reconvene and expand to include those contacts within healthcare industry that is tasked with recruitment, resource, and retention of healthcare providers, in hopes that we can streamline efforts to recruit and retain healthcare.
Commissioner Boyce?
Did you get to, Ms. Madison, did you get to see Ken Duquesne's presentation today?
I did.
Good, Curry Community Health.
Mm-hmm.
They're a little bit ahead of us right now, and they are trying to fill a couple gaps real important to the entire county. And you saw him reference the 3 main communities there. So we're still trying to pull them in. You know, we're just in some fierce competition throughout the whole country and even in the West. So we're anxious to take on that challenge. I couldn't add anything else to your presentation, and so after just one meeting, there seems to be some legitimate interest and concern and willingness to jump in. So, yeah.
Commissioner Gold?
So I'm just curious, what is the county's role in going out and recruiting physicians and nurses, that sort of thing? How do you perceive that?
I don't know that we have a role in recruitment hands-on. It seems to me where initially we thought it was human resources in these entities that were doing that, it actually seems more the role of CEOs and CFOs. And so that's something that just today I've learned we will need to redirect some efforts in. But that's probably good because they have the liberty to negotiate salaries more, wine and dine, engage them in community buy-in. I think, in my opinion, the role of the county would be to help keep those parties informed and collaborated and moving forward.
Because I know there's a lot of incentives for doctors to come here via getting their student loans. They can take care of their student loans that way by being in a rural area. And I don't know whether that's being advertised or what's going on, because I personally have gone to the clinic in Brookings, lost 3 doctors, gave up. I'm down in California now.
Right. And so, yeah, it's incentives like that that we all want to come together and put together a package and streamline that package so we're all on the same page. So if you're looking for a healthcare provider position at CCH or through the hospital, you're going to see that same packet of information, and it's going to show that we have some unity in what we're promoting as well. Of course, they'll have their exceptions with options they might offer that not everybody offers, but we're working to really collaborate and offer the same bigger picture that doesn't change, like natural resources or recreation. There is a certain market that is looking for this type of environment, and we just need to go out there and say, hey, look at us, look how great we are.
Quite frankly, I don't think we're ever going to really get the specialists in this area, but I think probably the best thing that we could possibly do for this area is get some of the specialists from over in Medford and some of the bigger areas to come here maybe on a once a month, twice a month basis. But all of your big operations and so forth, if you want to get the best, are going to have to be taken care of in the bigger cities.
Commissioner Boyce?
I think the best thing we could do for the county when it comes to healthcare is unite our county behind one hospital, 2 emergency rooms, and all the healthcare providers that we can possibly encourage to come here. And that effort to unite this county is, I just don't see a bigger issue, actually.
Commissioner Gold?
I'm going to have to disagree with having a standalone emergency room in Brookings for several reasons. Number one, there's more cost for patients, more risk for patients. According to CMS, they frown on having standalone emergency rooms. I've done a lot of research in this area. Maybe we can talk about it later, because there won't even be any observation beds there, and the patients are going to have to be transported several times in order to get the health care they need. And if there were a real emergency, not good.
As we grow and move forward, those are easy, well, not easy, but not insurmountable problems. It still comes back to getting this county together, and we got 2 years left to do that. So I challenge you and encourage you on that, ma'am.
You know, it's possible to have a critical care access satellite hospital in Brookings, and I think that's what we need to be moving forward to obtaining. But I don't know
And
that
it'll
this
divide
is
the county, and it will it'll hurt Sutter, it will hurt Curry General, and maybe the census will show we have 60,000 people in Curry County, and that might change the flow. That's all I got. Thank you.
I would just like to add, I know over in the valley they have the same problem where they have difficulty recruiting doctors, or I shouldn't say so much recruiting them, but retaining them. There was actually a study done over there that a lot of it came down to the spouse, where the spouse wanted to make sure there were amenities in the community, and if they were lacking in the community, they didn't stay. So I think that becomes really important when you're talking about collaboration, is working with the cities and the other agencies to make sure we have those amenities that the spouses want, so that we can retain the professionals.
So coincidentally, that's a good point. A couple of people had asked why we would include a party from Main Street, and that has a lot to do with that.
Mr. Chair.
Commissioner Boyce?
Just a question for the board. Do you feel like this is part of economic development? Curry General Hospital, if it's not the leading employer, it's pretty close behind South Coast. And so are we on the right path here? I mean, this is a workshop just to discuss the direction and responsibility we have, and healthcare. I mean, average age, median age in Curry County is 56. And so it's, especially when it comes to Curry General, the people I've talked to lately especially have had very good experiences there. And I'm a Sutter Coast guy too, because that's the best thing for my county, to have 2 healthy hospitals and competing hospitals. So anyway, that's all. I just, other than to direct that question to the board and see if it is part of economic development.
Commissioner Gold?
I think it's our duty to be able to get the best health care, equitable health care, affordable health care for the people in our county, whether it's South County, Central County, or North County. And I'm a big advocate for that.
Okay.
Thank you.
Any more questions?
No?
Okay, thanks for your time.
Retention, you said too. That's a big one. Thank you. Great job.
I think with that, is there anything further?
Nope.
This workshop is adjourned.